Georgia Republican Tom Price. He is the chairman of the Republican Study Committee, and also Pennsylvania Congresswoman Allison Schwartz is a Democrat on the Ways and Means Committee. Welcome to both of you. Good to have you here.
Hey,
let's jump right in. Congressman Price, you wrote a letter. You said you want Mr. Foster to come before Congress and explain exactly how he got these numbers and when he knew this and why you didn't hear this argument during the debate, right?
Exactly. I think that's what the American people want. As a physician, I've got real concerns about the quality of health care under this bill and about the access to health care. But what this is about the cost. And we were told, as your lead-in demonstrated, that this would actually decrease the cost of health care for our nation. But in fact, the CMS actuary, the person in charge of figuring out within the administration how much this is going to cost, has now said, oh no, it's not going to decrease costs, it's going to increase it by $311 billion. We think that if that information had been known, if we had waited for that information instead of ramming this bill through, that many individuals might have had a different take on the bill itself.
Congresswoman Schwartz, what do you think about that? Should he testify? And is this, worth knowing?
Well, it's always important for us to have all of the information that we possibly can, and we're going to continue to see different reports, and we've seen different economists come up with a lot of different studies. What this report shows, and look, let's be clear here that Congressman Price and Republicans are really calling for repeal. They want to stop this. They want to slow it down. We took 16 months of very, very serious debate about all the aspects of this law. What the report showed, is that more Americans will have access to coverage, that Medicare trust fund will be extended. The solvency may not just be extended 9 years, but 12 years. That seniors will see a reduction in their costs, and that in fact all Americans will see a reduction in their premiums.
Yeah.
So that's actually all good news. It's actually consistent with the clip that you just ran. The fact is that this health care law, and it now is law, we're going to continue to have many hearings about how we implement this law. But the point is not to stop it, but to make it work.
I hear what you're saying, but I can't help but feel that Americans at home watching this, and they've heard both numbers, right? They hear the president come out with his numbers and Democrats with their numbers, and Republicans come out and say, oh no, it's not going to save you any money. I don't think most people buy any of it. They say, look, you know what? I guess I'm just going to find out the hard way over the years whether or not this ends up costing me a lot more or whether or not it costs me a lot less. I don't think they buy any numbers, Congressman Price.
You're exactly right, and that's why the CMS actuary, again, this is the objective individual within the administration, whether it's Republican or Democrat, that determines what the costs of these pieces of legislation are going to be. And Allison's right, this is now law, and the American people said before it was passed that they didn't want it, and now as these particulars come out, they're going to say over and over, no, you got to do something to fix it. And we want to fix it in a way that puts patients and families and doctors in charge as opposed to the government, and that's the fundamental difference between the two.
Congresswoman Schwartz, would you like to hear the testimony of Mr. Foster? Do you agree that he should go before a hearing?
Well, let's just be really clear here that we are required by law to use CBO numbers. It's an independent congressional budget office that works with both Republicans and Democrats. And the fact is that Americans want this to work. They want to see those kind of consumer protections that are beginning, some of them right away, to make sure that no pre-existing condition exclusions, make sure that they can buy insurance even if they have a health condition.
The reality is that what they're hearing
and that is going forward. And we should hear from, and we did hear from all of the economists, and we will. But the point is not to stop this legislation, not to yet again wait another decade, say to Americans, you're on your own, too bad. The fact is that Americans are all going to have an opportunity to buy affordable choices in private insurance, and that's going to help benefit all Americans.
And that's why it was voted into law.
But it's true.
What I'm saying is,
hold on one second,
Congressman Price, what I think the best indicator of this is from the other side. You have to look at companies and what they're saying, and you have AT&T and you have John Deere saying this is going to cost us a boatload of money, and in some cases we may have to look at this and say it's really not worth it to cover folks anymore.
That's exactly right, and that's what we said going in. We said, look, there are studies that will demonstrate that over 100 million Americans will be moved from their private personal insurance onto the government plan, onto these exchanges that are going to be put in place.
And those are not government plans. You know that's true. The exchanges are private companies that will compete and offer an affordable premium to Americans who can't afford it. This is not a government-run system.
Well, sure it is.
You know what?
Absolutely is.
I think we have to go. Congressman Price and Congresswoman Schwartz, thank you so much for being here.
Patient-centered health care is what we're all about.
And so are we.
I think the proof is going to be in the pudding when things start moving and people start feeling changes happen, and hopefully there'll be good ones. Thank you so much to both of you. Good to have you here today.